This congressional conversation is sponsored by AARP Nevada. Visit our website at aarp.org/NV. Your voice, your vote, our fight.
Hello, and thank you for joining us for the Review Journal AARP 2020 Congressional Candidate Interview Series. I'm your host, Steve Sebelius. We'd like to thank our sponsor, the AARP, and also all of the candidates running for the United States House of Representatives who've agreed to join us for this interview series. In this conversation, we'll be speaking with Congresswoman Dina Titus, the Democratic incumbent in the 1st Congressional District. She is also the Dean of the Nevada Congressional Delegation and a longtime former professor of political science at UNLV. So, Congresswoman, thanks for joining us.
Well, thank you for having me. It's a pleasure.
So let's start with the coronavirus. Obviously, we're doing this interview over Zoom. Normally, we would be together in a studio, face-to-face, asking these questions. The coronavirus has, as you know, here in Nevada, caused unemployment that reached depression-era levels. And a lot of that unemployment falls most heavily on older people older than 50 years old who've been displaced from their jobs. What ideas do you have to help those older workers recover economically from the effects of the coronavirus?
Well, you're right, Steve. Whenever the economy is hit hard, it's harder in Las Vegas because we depend so much on the service industry, travel and tourism, hospitality. And so it takes a while for people to have money in their pocket or feel safe to want to go on holiday. So it has hit very hard. We're still twice the unemployment rate of the national average, and it may take up to 4 years to get back. I represent the heart of the district, from the airport to downtown, all of the strip and all of the downtown area, Glitter Gulch, they used to call it, but also the ethnic parts of town, the Hispanic East Side and the Asian West Side, where there are a lot of small businesses that are ancillary to the gaming industry. Those are also, many of them, family owned and have people over 60 or 65 who run those businesses. So it is a serious problem. In the CARES Act, there were provisions for unemployment. So that would be whatever age you are, and I strongly supported that. There was also that supplement of $1,200 that everybody got, which was certainly important. But that only gets us through just a little while. We recently passed the HEROES Act. We did it twice, second time with a little less funding, but it had some things that affect seniors. Certainly, there was something in there to keep your drug prices from going up because the donut hole might go away. We want to be sure that that's kept there, and drugs are such a big, important part of seniors' expenses. Also, to be sure that we maintain the health care coverage. I mean, when you've got a virus and a pandemic and you're threatening to do away with coverage, that's the wrong direction to be going. Loans to small businesses. But when this is over, many of those jobs may not come back. And so seniors who kind of fall in the gap won't be able to maybe get a job or restart their business. And so we have to look at long-term recovery. There are some programs for retraining of people to go into more high-tech industries. That's certainly something that workforce development is doing here. There's some funding for housing assistance, which is always a big expense that we can do here. Some funding for caregivers, respite care, family care includes seniors, excuse me, as well as children. And then I think the most important thing you can do is keep Social Security and Medicare solvent and protect those two things. Now, the president said he was going to do that, but then you got a $500 million cut in his last budget for Social Security. You're looking at doing that payroll tax, which reduces the funding going into Social Security. But Social Security and Medicaid are the most successful programs that we've ever had in this country. And to protect those, I think, is one way that we can protect seniors regardless of what the circumstances are.
Yeah, absolutely. And I promise we will talk about all those issues you mentioned That's a great overview of what we're going to talk about. We'll talk about them all in depth. We have laws that say you can't discriminate against people because of their age in hiring. But I think a lot of employers still look at an older worker and say that person's going to demand a higher salary because of their experience. They're going to cost me more in insurance because they're more likely to have medical problems. I'm better off hiring a younger worker, even if that younger worker can't do what the older worker can do because of experience. Is that still a problem, you think? And what can be done about that in addition to the laws we already have?
Well, certainly we do have laws that protect you from discrimination against age, but you're right about it. You see it at the university. Instead of hiring a full professor, they'll hire 2 assistant professors because they can get more coverage for less money. And that's a problem. But we just need to be sure that those are enforced. And I know that part of Joe Biden's senior program is to be sure that those kinds of programs are strongly enforced and that there's an agency within the equal rights that looks at that very specifically.
Yeah. All right. Well, we are going to talk, as I said, we are going to talk about a lot of these issues coming up. So stay with us as our AARP Congressional Candidate Interview Series continues right after this.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the AARP Congressional Interview Series. We're speaking with Congresswoman Dina Titus, the Democratic incumbent in the 1st Congressional District. Congresswoman, a lot of people are saying that we will not get back to normal, especially here in Las Vegas, until there is a coronavirus vaccine. And we've heard a lot of promises about the vaccine. It's going to come before the election. It's going to come right after the election. Some say it won't be here till next year, maybe next spring. What do you hear about that, and what can you tell us about the progress of the development of a vaccine?
Well, the president didn't cause the virus, but certainly his lack of plan has made the situation worse, whether it's the testing or the tracking or the vaccine. You hear from the medical experts that it won't be until next year. Then the president says he wants it by election time. I think we better listen to the experts and know that they won't probably have it developed. And even if it is developed, you want a vaccine that's been tested across a number of different demographics. You want to be sure it's safe and doesn't have other kind of side effects. And then we need a plan for the distribution of it. Now, in the HEROES Act, it calls for Medicare and insurance companies to cover the cost of the vaccine. So it would be no cost to you, as well as the cost of coverage. Right now, under the CARES Act that we passed originally, you don't have to pay for a test, which is good, but we don't want you to have to pay for a vaccine either. And we want to be sure that when it's ready, it can be distributed across the population, across the country, and most likely starting with seniors, because we know that they are the most vulnerable in this pandemic. I think it's 80% of the cases of deaths are people who are in that older contingent.
And did you say that the funding for the free vaccine is contained in the HEROES Act, which has not yet passed?
It's passed twice out of the House, but not out of the Senate. Now, the Senate says, oh, we need to take a pause. We don't need to spend any more. We're worried about the deficit. Well, they weren't worried about the deficit when they did the big tax breaks for the wealthy. And I don't think people in my district who are concerned about getting back to work or staying well are worried about the deficit. They're worried about their own circumstances. The latest we heard since the president has gotten the virus himself is that, he wants the Congress to pass another recovery bill. And he is pushing McConnell and the Senate to get busy and come up with a deal. I know that they're still talking in Washington about some kind of compromise, but the last time they mentioned it, the Democrats went from $3 trillion to $2 trillion, and the Republicans went from 1.6 to 1.2. They were moving in the opposite direction. So some of those critical things that we believe should be in the bill have got to be part of the final deal.
Yeah. Let's talk about the Affordable Care Act. Republicans have tried to repeal the Affordable Care Act uh, numerous times, we'll say. I've lost count of how many times, but I
Over
think,
60 times they voted to get rid
yeah.
of it.
And there is a lawsuit pending before the United States Supreme Court now that would eradicate the law in its entirety, including its protections for pre-existing conditions. Now, I know during the last campaign, you came out for a Medicare for All program, first member of our delegation to do so. But I take it that given that doesn't look like that's going to be a possibility, you've also endorsed Joe Biden. He says we need to expand the Affordable Care Act with a public option. I imagine you look at that as an interim step towards extending Medicare to all people.
Well, you're exactly right, Steve. I was there when I voted for Obamacare, and I thought it was one of the most important votes I could cast because in Nevada, we had one of the highest uninsured rates in the country. And so people here needed that access to health insurance. You remember that the bill on the House side included a public option, and that was to allow people to buy into the public option, and hopefully it would keep rates down because it would be competitive with the private insurance companies. When it came out of the Senate, they had done away with the public option. Now, over time, I have always said that healthcare is a right, not a privilege. Everybody in a country this wealthy and this powerful should have access to healthcare. Every other Western democracy provides that. So I think we need to move in that direction. However, you're not going to get there overnight. We're playing defense as it is, as opposed to strong offense. As you said, we voted over 60-something times against the Republicans' efforts to get rid of it. They have said we need to repeal and replace, but they've never offered anything to replace. And then they've gone after it in the courts. And the day, I think the week after the election, that case is supposed to come before the Supreme Court. And that's why the president is pushing to get the appointment of a person who has said and written and argued that it's unconstitutional. He wants that court lined up to overturn the Affordable Care Act. They've made no bones about it. And then where will we be? We'll be back in trouble.
Yeah, we may be having a very
Biden
different conversation about healthcare after that ruling comes down. But we're going to take a quick break. And when we come back, we're going to talk a little bit more about the Affordable Care Act and about the effect of a public option on private insurance. So stay with us as our AARP 2020 Congressional Interview Series continues right after this.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state, because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to our AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus, the Dean of the Nevada delegation. We were speaking before the break about the Affordable Care Act and expanding that to include a public option. There are people, I've heard this argument, it's a newer argument that's being touted, saying that a public option within the Affordable Care Act would be the death knell of private insurance. In other words, millions of people who currently get their insurance through their employer or through their spouse's employer would lose that insurance if there was a public option. What do you think of that argument? Have you heard it? What evidence is there to support or refute it?
I don't think so. I think that public option is, or if you want it, it's not going to affect the private companies, not going to affect the labor unions policies. Many people who have the basic Medicare, in addition to that, buy a supplemental, which complements the policy that they already have. The insurance companies would be able to provide that. This just opens up access to those Medicare, if you want it, possibilities. And
Mhm.
I support that. I think you could also drop Medicare down to 60 or 50 even to allow people to buy into it if that's a program that they're interested in. And having those people buy in gives more funding to Medicare so that it stays solvent. And you got younger people who are not as sick or maybe as needy buying into the system, which also tilts the risk problem.
Yeah, that's a great question to pivot into our next subject, which is Social Security. There have been some people who have called for either fully or partially privatizing Social Security, taking those withholding taxes, investing them in the stock market, and distributing returns to Social Security recipients out of the gains. Hopefully, there will be gains from the market. What do you think of that idea? Do you support that or oppose that?
No, I'm opposed to that. I think that's a terrible idea. Social Security is supposed to provide that guaranteed safety net. And I go back to what I said earlier, it's one of the best programs this government's ever had. If you let somebody invest it in the stock market, if the stock market's up, yeah, maybe you get a little more. But what's going to happen when the stock market is down? Then you'll be without any kind of benefits or safety net at all. So I have been absolutely opposed to privatizing Social Security.
Yeah. There's been a lot of discussion about this program. We keep hearing a moving target, the date that Social Security will, quote unquote, go bankrupt. What they mean by that is that it will not be able to pay benefits at the 100% ratio that they're being paid right now. I note with some bemusement that target date, whenever it seems to be, is always the year I was planning to retire. So that will be the year when it runs out. The latest year is 2035, but the trustees say that may be too optimistic given the coronavirus crisis, because people are not paying in. They've lost their jobs. They're not paying Social Security withholding taxes. So that may have moved that date up. How concerned are you about the solvency long-term of the Social Security system? And we can talk a little bit later about some of the remedies for it.
Yeah, well, I am concerned about it. And that's one of the reasons that I'm opposed to the Donald Trump's proposal to eliminate the payroll tax. I mean, he said that businesses don't have to pay their share and then they'll have to pay it back next year or over the course of 2 years, and wanted to eliminate it for people paying their individual share. That money goes to Social Security. That's why people say it's not an entitlement, it's something I earned. I paid into it, and so I'm entitled to get it back, and that's absolutely right. But if you eliminate that tax, even though they say, oh, well, you'll have to pay it back eventually, maybe you will and maybe you won't. You know, there's nothing like going back to Congress and saying, we hadn't been paying this taxes, let's not reinstate it. And you can imagine the political arguments around that. But if you eliminate that payroll tax for both the businesses half and the individuals half, that is money that's going into that Social Security box that will not be there.
Yeah, absolutely. Well, we will come back and talk a little bit more about the long-term health and longevity of the Social Security program when we take our next break in our AARP 2020 Congressional Interview Series. Stay with us.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus of the 1st District here in Nevada. We were speaking about Social Security. Congresswoman, the support for Social Security is high, and that's across all demographics. 93% of Republicans, 99% of your fellow Democrats, 92% of independents all say it is an important government program, as you said. One of the most successful social programs that's ever been conceived in America or anywhere else. But despite that, 57% of people are not confident in the future of Social Security. They either say they don't trust the government to keep its promises, They think money is running out. They think politicians have taken money from Social Security in the past, what surely has happened. What do you tell people on the campaign trail when they come up to you and they say, I'm worried that Social Security will not be there for me when I retire, or even now that I am retired, that I won't continue to get benefits at the level I'm getting them now?
Well, the first thing I do is reassure them that I will always fight to protect Social Security, and that's been my record. You've seen it in some of the legislation that I've supported. And also try to keep the rates that you have to pay for Medicare down, tied to the benefit that you get from Social Security, so you don't go in the hole in any given month. I don't think that you need to worry about Social Security going away. It is such a popular, successful program that I believe it would be political suicide to get rid of it. Now, the president promised during the campaign he was going to protect Social Security and Medicare. But like I said, he's put out budgets that cut those programs. I think I said 500 million. I meant 500 billion in the last budget. But Congress has stood strong. And the reason, too, is because it is bipartisan. You know, there aren't many things in Congress these days that are bipartisan. We're such a polarized nation. But those statistics that you just gave show that seniors support this regardless of what party they belong to. And they're worried, you know, you often hear about you should put Social Security in a lockbox and not let any other government programs pull money out on it. And that would be great. It doesn't quite work that way, but as long as you have a commitment and a promise that the money will be there, if it's not there through what you pay in, you'd have to supplement it from general funds or other sources.
Yeah. You know, the Committee for a Responsible Federal Budget, which is a bipartisan group, examined Social Security after the last trustee report. And they say changes should be made promptly given the high cost of delay. That there's an urgency to making some changes to the system to ensure its longevity. And we'll talk about some of the various proposals that have been made in the past, some proposed by Democrats, some by Republicans. But do you agree with them? Do you see this as an urgent priority, that something urgently needs to be done to preserve the future of Social Security?
Well, we certainly can't ignore it. I believe that it may not be 2035, but it's not going to happen tomorrow. It's not that kind of impending emergency, but the sooner you fix it, then the more security you'll have down the road.
Yeah. Okay. Well, let's talk about some of the different ideas, and we can go through these one by one. There are some people say we need to raise the Social Security withholding threshold. As you know now, it goes to about $120,000, $130,000 of wages. After that, you're not taxed on Social Security wages. There are some people who propose raising that threshold, saying it should be $200,000, $300,000, $400,000. Do you agree with that idea?
I think you can certainly look at it because the value of money has changed over time. Inflation rate has changed over time, but you still want to keep Social Security a program that is universally applicable. You don't want to make it just a program for the poor. You want to be sure that it is as it was intended to benefit all people in all categories.
Yeah, absolutely. Absolutely. Okay. Well, we're going to take another quick break, but when we come back, we're going to talk about some more ideas that people have had on both sides of the aisle about how to stave off that date when Social Security may not be able to pay its full benefits. So stay with us as our AARP 2020 Congressional Interview Series continues.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to our AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus, representative of the 1st Congressional District. That's right, she represents the Las Vegas Strip. Congresswoman, there are other people who have said that we should increase the current withholding tax from its current level, maybe increase that on everyone, not just on wealthier people, but everybody from when they start paying those taxes all the way to when they stop the percentage. Do you think that's a good idea?
I don't think you need to start talking about raising taxes on people right now when we have such high unemployment. So maybe that's something that they look at in the future, but I'm not advocating that at this point.
Mm-hmm. Now, this one's controversial, and that is people say perhaps we need to look at reducing benefits to Social Security recipients. I was speaking with your colleague, Congressman Stephen Horsford, the other day. He said the average Social Security benefit in his district, the 4th Congressional District, is just $1,000 a month. I'm not sure what it is in your district, but would you support in any way reducing benefits in order to extend the life of the program?
No, I wouldn't do that. That's not the point of the program is there to help you. I think it's about $1,400 really statewide is the average benefit. Now you think about trying to live off of that, and then you want to reduce that further, and you've got the whole notion about raising those benefits based on cost of living. And yet the cost of living of seniors is higher because they have got the cost of medicine and transportation, sometimes things that should be tied more to that index that measures what their costs are. So no, I wouldn't support reducing it. In fact, you might look at a scale and see where you give higher benefits to the oldest citizens. I think Biden is looking at something like that because their expenses are greater.
Yeah. There are some who say that we should raise the retirement age to obtain full benefits. Now if you wait a little bit later to retire, you get a larger benefit than if you retire at an earlier age. There are those who say that this would disproportionately impact minorities because of the life expectancy in some minority communities. What do you think of that idea?
I agree that it would affect minorities. It also would affect people who retire who work in hard labor jobs. If you're out working in a field or digging pipelines or constructing houses, those are jobs where you can't keep doing it until you're 75. Maybe you can if you're in some kind of office work or in a university or something like that. But I don't think that would be fair.
Yeah, okay. How about this is my favorite one, a means test for beneficiaries. If I go down now to the Green Valley Ranch, as I've used the example before, and I hit the megabucks jackpot, my income goes through the roof, and all of a sudden I'm wealthy. I never have to worry about working another day in my life. When it comes time for me to retire, I don't need those Social Security benefits. Now, you said earlier it's not an entitlement program. You've paid in. I've paid in all my life since I've been working. But if I don't need those benefits, shouldn't they go to somebody who does need them?
Well, I support means testing for some kinds of programs, but not for Social Security. Social Security was intended to be a universal program, take care of everybody, those who pay in. If you start selecting people out, then you're picking winners and losers, and it's a real opportunity for the program to evolve into something that's not fair.
Mm-hmm. So even the wealthy should receive a Social Security benefit.
Well, as they are doing now.
Mm-hmm. Okay. All right. Are there any other ideas that I haven't mentioned that you have heard or that you would support that would extend the life of the program?
I think the one that has the greatest cachet is to raise the tax level instead of stopping it at 120, but have higher levels that you pay into. And I think that seems to be the one most people talk about and consider the fairest.
Yeah. Would that be, do you think that would be just a flat tax on wages up to that amount, or should it be a progressive tax so you pay the full rate up to 120 and then maybe half of that 120 to 200 and half of that from beyond that, or should it just be a flat rate on all wages up to a higher amount than it is now?
I think it's more of a graduated situation. I haven't studied the numbers yet. Before I commit to anything, I'd have to do that if indeed they move in that direction. But it seems to me graduated would be better.
Yeah. All right. Sounds good. Well, we are going to take a quick break. And when we come back, we're going to talk about another social welfare program that people have said is one of the best ever, and that's Medicare. as we continue our AARP 2020 Congressional Interview Series with Congresswoman Dina Titus right after this.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to the AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus of the 1st Congressional District. Now, Congresswoman, we've already discussed the Medicare for All program. You are, I think, the first, and if I'm not mistaken, the only person in the Nevada delegation who has supported extending the Medicare program to everybody. We know that that's probably not going to happen anytime soon. Certainly, the Democratic presidential candidate Joe Biden does not support that idea. But even keeping the program as it is for people with disabilities and those who are 65 years and older, if we just kept it as is, the trustees of the Medicare system estimate that in just 6 years, it's not going to be able to pay full benefits. Now, an AARP poll found that 93% of its members want congressional candidates to talk about the longevity of the Medicare program. So here's your opportunity to speak to that 93%. Are you concerned about the longevity of the program, and what ideas do you have to make sure it's in place for when people are about to retire actually do?
I certainly want to be sure that we keep it in place and that we keep it solvent. I think it's one of the most important programs that we have. One of the things that we could do to save money just right off the bat that would be so simple is to allow Medicare to negotiate for drug prices like the VA does, to bargain for prices as opposed to just kind of have to take whatever the pharmaceutical companies give us. Now, we've tried to do that through legislation. We can't seem to get it out of the Republican Senate. The president's hasn't supported it. The pharmaceutical companies are very powerful then. So I think that's one thing you could certainly do that'd be easy right off the bat to save money.
Yeah, and I'm given to understand that that would save a considerable amount of money, enough to not only extend the Medicare program well into the future, but also perhaps to expand benefits.
Well, exactly. I support expanding benefits to cover vision and hearing and dental. You know, that every part of you is connected. If you got bad gums, you got bad heart, or you can't hear, you're more susceptible to things. So I think that would be a positive to be able to expand some of that coverage.
Yeah, and that was going to be one of my next questions, which is about the dental care. I was surprised when I first learned, perhaps I shouldn't have been, but when my wife's dad, when he was alive, needed a dental procedure, and I naively told my wife, well, he's got Medicare, so, you know, and she said, no, Medicare doesn't cover dental. I did not know that until that point. I probably should have, but it seems like dental, vision, routine foot care for people who suffer from diabetes, hearing aids, fitting for hearing aids, exams for prescription glasses. Those are all things that are needed by people who are 65 years and older, probably in greater proportion than anybody else in the population, and yet they're not covered by Medicare. So you think we ought to expand the program to cover those things?
Especially hearing aids. Look at how many people are hearing impaired that need hearing aids, and that's not covered. And the hearing aids are fairly expensive, but if you had some kind of where you could negotiate prices because of the numbers that are available, then you could certainly help to bring that price down and provide that service. You know, there's so many things that are just hard to imagine because they go against common sense. For example, in the Affordable Care Act, you could go and get a colonoscopy, and that would be covered, totally covered, because it was to help you determine if you had a problem. It was, you know, the term skips my mind, but anyway. But if they found a polyp and took it out, then it was not covered, because then it became a medical procedure as opposed to something that was preventive care. And
Wow.
how much sense does that make? So
That
there's
does,
a lot of the kind of common sense things that you can do.
yeah, that does not make sense. So I guess we found that out when we passed the bill, that's something that's not. Um, Real quickly, we have about a minute left in this segment. You said earlier you don't think now is the time to raise taxes because of the economic hardships that we've had to endure because of the coronavirus and the shutting down of large parts of the economy as a result. But do you think there will ever be a situation where we may have to consider a tax increase in order to extend the life of the Medicare program?
Well, I think a better thing to do would go back and revisit the tax program that was passed a couple of years ago, where all the breaks were given to the people at the very top as opposed to distributed down the economic spectrum. That would bring a lot more revenue into the government, because right now that helped to create a huge deficit because that tax revenue is not coming in because of those big loopholes and breaks that the wealthiest got.
Yeah. All right. Well, we are going to take another break, but we'll be right back with more of our conversation with Congresswoman Dina Titus as our AARP 2020 Congressional Interview Series continues. Stay with us.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to our AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus. We're talking about Medicare. You've already said that you think that Medicare ought to be able to negotiate for prescription drugs the way that the VA is able to, so that the vast purchasing power of the program could be used to bring down the cost of those prescription drugs. So far, that proposal's been around for a long time, hasn't found purchase with some Republicans, and so it has not yet gotten to hearings, not yet gone to the president. The president himself actually once said that he thought that should happen.
Well, the president said a lot of things that he flips around the next day or even at the next tweet that is in disagreement. He also said he would save Medicare and Medicaid and Social Security, or Medicare and Social Security, and then we see that he attacks those. He said they're going to bring down the cost of drugs, but we haven't seen that legislation passed. He made a big deal about signing an executive order that we're only going to pay what they pay in foreign countries. That was just total smoke and mirrors. Nothing has happened about that. He was going to give everybody a $200 Medicare card with his signature on it to use for drugs. That you hadn't seen that card, have you? That certainly
I have not seen that card, no.
So there are a lot of promises that have not been kept. You know, we ought to look at generic drugs and how the cost of those can be brought down, or look at the universities and the research that's done with federal money, and then those drugs come out costing so much. I'm on legislation that is opposed to gouging for any of the price of the therapeutics or the medicine to treat or the vaccine for this whole pandemic, so that the pharmaceutical companies can't take advantage of this situation.
Yeah, it would seem to me logical to say that if the taxpayers have underwritten the research that leads to the creation of a drug, that drug should then be the common property of the taxpayers and should go to them at generic drug prices. But I don't know that that's necessarily the policy of the United States currently, is it?
Well, no, it's not. And oftentimes those drugs aren't even competitive. I mean, they're like the only drug that's out there. They don't even have to worry about being competitive. Something else we ought to do, you know, when you're watching TV, what are the most commercials that you see? Drug commercials. That's because they're able to deduct the cost of advertising. No, other companies don't get to do that besides pharmaceutical companies. There's a whole array of things we could look at that could help bring down drug costs.
Longtime viewers may know that you were in the Nevada State Senate and were the Senate Minority Leader for many years. There was a senator who is currently serving in the Senate, Ivana Cancela, who had a bill, a bipartisan bill, that brought some transparency to the pricing of insulin and later to the pricing of drugs to treat asthma. Do you think that would be an effective policy on the federal level to bring a drug transparency bill so that people could see what was involved in the pricing of drugs?
Oh, no question about it. We've got the Fair Drug Act, what the name of it is, something like that, that we've already passed that would help to bring down the cost, provide more transparency, have certain drugs listed that you could not raise the prices, including insulin. If the president really wants to bring down the prices, all he's got to do is tell McConnell, send that bill over here to my desk and I'll sign it. It's there waiting for him.
Yeah, so because the pricing regimes seem to be a Byzantine, which is, I guess, true of healthcare in general, right? The pricing of healthcare, what you pay, what the insurance company pays, what everybody's supposed to pay, what it actually costs is a Byzantine thing hidden from public view. There's not a menu. You go to McDonald's, there's a menu. You know what the Big Mac costs, and you pay it. It's not the way it is in healthcare.
No, you don't get to make those choices. You get the bill at the end of the day and find out that Tylenol costs you about $25 for one pill. So we definitely need more transparency. I know Nevada has an ombudsman, or did have, because I supported that when I was in the Senate, to help you just navigate some of the very complicated healthcare bills that you get.
Yeah. All right, well, we're going to take our final break. We'll be back with our AARP 2020 Congressional Interview Series right after this. Stay with us.
Today is full of opportunity to connect with others, grow as a community, and even improve lives. And AARP is in Nevada, helping to make it all happen, with resources to help you steer clear of fraud, helping to make our community accessible for all, and fun and educational events all over our state. Because AARP has real value for you, your family, and for everyone in Nevada. So let's take on today together. Learn more at facebook.com/AARPNV.
Welcome back to our AARP 2020 Congressional Interview Series. We're speaking with Congresswoman Dina Titus. There has been a lot of attention put on nursing homes since the COVID-19 epidemic started. A lot of nursing homes have been centers of where this disease has been spread. What can you tell people about the safety of those facilities? Putting a relative there is a very difficult decision in the first place. Now there's coronavirus to consider. What do you think about that?
Well, it is tragic. There's funding in the HEROES Act to provide strike teams to go into a nursing home whenever there might be 3 cases reported, and then to try to track it and fix it and get people out to do whatever they need to do to keep it from becoming such a super spreader situation. In addition to that, sometimes you hear horror stories about nursing homes where, or even assisted living, where people who are seniors are taken advantage of or abused. So there's additional funding there to deal with elder abuse. And I think that's very important too, because sometimes that falls through the crack, as well as respite care. You know, we've put more funding in for family leave if you are taking care of a senior or a spouse or a parent, so that you count that just like you do with a newborn baby. But what we forget about is respite care. People sometimes just need an hour in a day to go be by themselves or go to the grocery store or get their hair done or whatever, and they need some place where they can take a senior or somebody who can come in and be helpful. So all of that, I think, relates to how we can do a better job with nursing homes and assisted living.
Yeah, and you know, in the coronavirus, a lot of our business is now being conducted over Zoom electronically as we're talking now. Telemedicine is a big part of that, and I understand you're a co-sponsor of a bill that would basically expand that telemedicine for people. Talk about that a little bit.
Yes, that's the Access Act, and so we have more funding to use telemedicine, which is very important in a state like Nevada with rural areas, but in the inner city too, we need to be able to provide services to people. So that is included in the Access Act, and also to try to allow people to visit people who are in the hospital through Zoom or through computers, because it's such a tragedy when a spouse or a parent goes in for COVID and the last thing you do is wave goodbye to them at the door. You aren't able to kind of visit through the new technology. So that's just all about providing greater access to information and contacts. And I'm pleased to be a co-sponsor of that.
Yeah, and certainly we can see the benefit in rural areas where you have to travel long distances to see a doctor in a city or a town that may be a great distance from your own home. What are the advantages in the urban areas where travel isn't the issue there, but is it access?
It is. If you think about where the new hospitals are being built or where the new doctors' offices are, they're not here in the heart of the valley. They're out in the more affluent suburbs. So just having access to that kind of care can be very important. You think you have lower access in rurals, but it's often the inner city and places like my district that you need to have that. And the VA has done a pretty good job with telemedicine. And so there's no reason why you couldn't do it with Medicare and Medicaid as well.
Yeah, and I know perhaps one side benefit is when you call in for those appointments, your waiting time, you're not sitting there waiting for a long time in the waiting room, or then you get taken to the exam room and wait a little more. They call you when the doctor's ready, and you have your appointment, and so it's a little bit easier in that respect.
It is. It's easier for the person who's sick, and also it keeps you from getting sicker. There's less exposure. There's less possibility that you'll come in contact with somebody who has something, who's in hospitals, sick people.
Yeah, absolutely. Absolutely. Well, Congresswoman Dina Titus, that's all the time we've got for this interview. I want to thank you very much for taking the time to spend with us to talk about these issues and talk to not only AARP members, but the community at large about some of these very important issues that you're dealing with in Congress.
Well, thank you for having me. And let me remind seniors, you can vote by mail or drop it off or vote early. We've made it as easy as possible. So get out there and vote in this election. It's going to be critical.
Absolutely. We echo that for sure. Well, I'd like to thank my guest, Congresswoman Dina Titus, for participating, and thanks also to the AARP for sponsoring this interview series. You can stay up to date on all the 2020 political news on our website, www.reviewjournal.com, or use our mobile app. Until next time, for the Las Vegas Review-Journal, I'm Steve Sebelius.